Welcome back to the Saudi Morning Show. Pretty much in the new 2014, we've been discussing about new awareness, I would say, especially in obesity, and we discussed a little about child obesity. Obesity is something that seems to be neglected more and more, and the percentage seems to be increasing every year after. And hopefully our next guest, Dr. Mustafa Al-Najjar, which is an obesity specialist, will clarify more and make more public awareness, inshallah, about obesity and the dangers of it. So welcome to the show, Dr. Mustafa.
Welcome.
How you doing? Please, for the viewers at home, tell us what your specialty is.
My specialty is in obesity management and in clinical nutrition and how to treat the obesity. First of all, I want to define the obesity is that is excess or abnormal fat accumulation that presents risk to health individual. The ways I can diagnose if that person or that patient is obese or not, there's two important ways: the body mass index or the BMI and the waist hip ratio. The BMI can be measured by dividing the weight by the height in meters square. But BMI or body mass index is not an accurate measurement. Why? Because some individuals are athletes, and when we measure the body mass index in the athletes, they will be identified as obese persons, even though they don't have that accumulation, because they have muscle body.
Yes, I'm sure like you see a lot of patients that they are large built to like
Yes.
they stay in same
Yes.
height and everything.
Yes, I always say that to the patient. Every patient come to me, tell me I am, for example, 150 centimeter. I am supposed to be 50 kilogram. That's wrong. The most accurate is waist to hip ratio. For instance, if the patient or the person is 160 centimeter, his waist is supposed to be 60 centimeter, and the hip circumference must be 80 centimeters.
And I'm sure it's like a lot of people they have different they speculate about what are some of the causes of obesity. Maybe it's because they're stressed. Maybe they say it's genetic. Some of them, and some of them they say no. I blame this type of food. Can you please?
Well, the causes of obesity is many, but the cause mainly is excessive accumulation of fat, as I said before. There is genetic cause. Age has a major role, because as we get old, we lose muscle, and muscle is responsible for increasing the metabolic rate. And when we get old, the muscle is lost, and we increase the caloric intake, so we will increase the weight. Other factors is midlife weight gain, especially in women in the mid-age after menopause. After menopause, there will be accumulation of fat around the waist. There is also lack of sleep. When the person or the patient don't sleep well, the hormone of hunger will be increased, so he will be overeat. If someone or somebody sleep, for example, at 1 in the morning, 2 in the morning, 3 in the morning, the hormone of hunger will be increased, and he will eat everything and overeats and will be obese. So sleeping well and sleeping early is very important in management of obesity.
Yes, and Dr. Mustafa, I'm sure like the impact of obesity on human health is very troubling. Can you please discuss about that briefly?
Okay, the side effects of obesity is in the health way. It may cause heart disease, atherosclerosis. Atherosclerosis is accumulation of cholesterol in the wall of the arteries. Joint disease, stiffness in the joint, may cause hypertension, diabetes. Many in the health branch or the health factor, it may cause that. In other way, in economic way, the government will pay much money to treat that people. For example, a patient come to me, very obese, morbid obese. He will have problems in the cholesterol, in the joint, he is hypertensive. the expenses of treating that the diseases is so much.
Yes, and I'm sure, Dr. Mustafa, you've seen a huge increase in child obesity. Do you think that you should try to do more prevention for the children at young age to make them more aware, make them understand that obesity is not something that should be neglected to something later in the life, to try not prevent it, but make more awareness at the earlier stage? Because
Of
it
course.
seems more people like the young kids, they starting to smoke, so there should be more awareness in the smoking at a young age. The obesity is becoming more of a health issues for young students.
Of course, I have to start with the parents, because if the parents have non-healthy lifestyles, the children or the infants will be impacted by these lifestyles. I also tell the parents, don't eat from the junk food or fast food, because the children or their children will do as they do. The most important thing in the infants or children is sport, eating vegetables or fibers, because fibers has a major role in preventing obesity, because fibers is called negative calories. Fruits is also very important. The most important thing is to prevent juices made at home or bought from outside or in the market, soda and sugar,
So avoid juice also.
all kind of sugar, even made in the home.
This
Okay.
is about the store-bought juices, Suleiman, which
Okay.
would say 100% natural or all
No,
original.
there is nothing
and
natural about it.
the only natural that you would get is not from the juice shops even, it's the one
It's
that
from
you
the
would
apple.
actually make at home. But with this, Dr. Mustafa, tell us a little bit about obesity, and we get to see, I mean, here we would like to again differentiate the people who are putting on a little bit weight to the people who are obese, because obesity is like, you know, the chronic weight gain that we get to see people having, and that could lead to many of the problems and complications too. But some of the people we get to see who are actually suffering with obesity, that they say they have tried all kinds of different diets. And most of the diets that they would tell you about, they would say that, you know, I did this diet and that diet, and most of those diets would come across to you as fad diets. So diets which would promise to help you lose kgs in a matter of weeks to sometimes in a matter of months. Tell us a little bit about those as well, and do they have a negative impact on the body?
Of course. The most important thing in managing diet is the behavior of the patient. For instance, I ask the patient, at which hour you wake up in the morning? If he wakes up late,
Yeah.
wrong. Why? Because when the patient wake early in the morning, for example, at Fajr, the metabolic rate will increase, because there is a special hormone responsible for increasing the metabolic rate from 6 in the morning or 5 in the morning till al-Maghrib. If the patient wakes up late, he will decrease that hormone and decrease the metabolic rate. Number two is to prevent the negative thoughts in the patient, because negative thoughts has frequent negative impacts on the patient. Because for instance, if patient overeats, he will say, I've blown my diet, and will continue overeating because he feel ashamed or feel that he has ate so much.
Yes, yeah.
Okay.
I can very much relate to that, because I just did that yesterday.
Okay, there's another sector or section is patient counseling. Patient counseling is an approach to learn the patient how to deal with the problem, not to solve the problem only. Another way is diet control. The patient has to eat all the kind of food: fats, proteins, carbohydrates. The fat diets you told about, for instance, don't eat fat. Eat only proteins, like Atkins diets.
Yeah.
Atkins diets can make you lose weight for about 9 kilos in 14 weeks,
And can give you a heart attack in 9 years' time too.
and will have problems with the kidney.
Yeah.
So the patient, I tell him, you have to eat well, eat all kind of food, eat what you want, and especially the juices. Juices is a big problem, because many people think that when they drink juice made at home, it will be good. No. Eat fruit, don't drink juice. Because when you drink juice, you drink calories. The glass of juice contains about 200 calories. When you drink the 200 calories, all of them will be converted to fat. Any fruit contains 60 calories. The 60 calories, when they eat, it will be in the end 20 calories.
Okay, let's go back to it again. As you said that juice would contain 200 calories.
A glass of juice.
A glass of juice,
Yes.
which is like 210 mLs, which is the standard pretty much. It would carry 200 calories,
Yes.
whereas the fruit itself
60 calories.
would be having 60
And
calories.
when you eat it, digest it in the intestinal tract, it would be 20 calories because the body needs calories to digest. So the body takes about 40 calories, 30 calories to digest the 60 calories.
Wow. And there are so many of the people that you would get to hear, oh, I'm on a juice diet.
No.
So they're going to be drinking juice. And a lot of the times you get to see them that, you know, it seems to be having not really
No.
any
The problem is
result.
that the fat diet depends on losing weight only. The good diet depends on losing weight and how to lose the weight and to
Eating
continue on losing weight even when you finish the diet. For instance, when about the fat diet, when the patient finishes the fat diet in 1 month or 2 months, in the 3rd or 4th month, he will be increased in weight even more the time he started diet.
So try to be more consistent.
Yes.
It's not a diet that's short-term. It should be a long-term diet.
Yes. When a patient comes to me, tell me I want to lose weight in 1 month, 2 weeks, I refuse because when he loses weight in 1 month, the 2nd month or 3rd month he will gain more weight.
Is this because sometimes we hear of the philosophy, Dr. Mustafa, that people say that if you do an Atkins diet, which is only a wholly, solely protein-dependent diet, so you're going to be only ingesting all those proteins, and of course, we know the problems of Atkins diet, bad bread to impact on kidneys, to the impact on heart and all those things, but let's put all those things aside. Let's talk about this extreme protein intake into the body. Now, they say after you do Atkins diet for a month or two, after this, when you go back to normal eating pattern, your body is gonna start storing all the carbs that you are
Yes.
eating because it's carb starved and it is afraid that you're gonna go back on a protein diet, so it would keep the carbs stored. Is that true?
Yes, of course. The problem is that when you finish, for example, the Atkins diet, there will be craving to all kinds of food, especially sweets and carbohydrates. When you crave to the carbohydrate and the sweets, you will gain more weight. The patient didn't learn why juices is contraindicated in diet, how to eat the sweets. The good diet, I can give sweets, any kind of sweet, chocolate, anything. But how to eat, it is the problem, or it is the point I concentrate with the patient. Because many patient is afraid, will I eat chocolate, will I eat sweets? I assure him and I tell him no problem, but eat that food in a good way, and I learn him how to eat. But preventing the patient totally from the sweets or chocolate is totally false.
Yeah. Because your body might get into the attack mode after you have
Yes,
come out of it. Well, with this, Dr. Mustafa Al-Najjar, we'd like to thank you so much. This is a very important subject. Lots of people are suffering with obesity
Of course.
in the kingdom currently, and also probably in another edition of the program, we can talk about the white poisons which are directly associated with obesity, which is salt and sugar. So hopefully that we can do another session about it. Thank
Inshallah.
you very, very much for
Welcome.
being with us. And also with this, we were in discussion with Dr. Mustafa Al-Najjar. He is an obesity specialist. He was talking to us about some of the reasons due to which you might not really be able to lose weight, or some of the complications that you might face when it comes to trying to lose weight, and some of the wrong practices of people and the wrong ideas that they have when it comes to food and nutrition. So we need to revisit our habits, and we need to revise our habits as well. If you have any questions from Dr. Mustafa Al-Najjar, feel free to send those to us on Facebook as well as on Twitter. For the moment, we are getting back again with Janad Ria with another report that is going to be showing you more about Janad Ria. Stay tuned, we'll be back after that. Thank you, Dr. Mustafa.